Let's talk about blackheads. Those tiny dark dots on your nose, chin, and forehead aren't trapped dirt, and they're definitely not a reflection of your hygiene. A blackhead, or an open comedone, is simply a clogged pore. Inside, there's a mixture of your skin's natural oil, called sebum, and dead skin cells that didn't shed properly. When this plug is exposed to the air, the top layer undergoes a chemical reaction called oxidation, which turns it dark. It's the same process that makes a cut apple turn brown. It's crucial to understand this because aggressive scrubbing won't fix it. In fact, it can make things worse. Many people also confuse blackheads with sebaceous filaments, which are normal, light-colored structures that line your pores to help oil flow to the surface. Blackheads are distinct, darker, and raised plugs. Understanding this difference is the first step to treating them gently and effectively without declaring war on your own skin. Today, I'll walk you through the daily routine that cleared my blackheads for good, and more importantly, keeps them from coming back, all without stripping my skin or compromising its protective barrier. This video is not sponsored. These are universal principles of cosmetic science that you can adapt with products that work for you. But before we start, 2 golden rules. First, always patch test new products on a small, discrete area for 24 to 48 hours to check for any reaction. Second, and this is critical, never, ever pick at your skin with your fingernails. Your nails harbor bacteria, and the pressure can cause permanent scarring, push the clog deeper, or create a much bigger, more inflamed blemish. Patience and consistency are your real superpowers here. To make this process easy to remember and follow, I created the SMOOTH-TM method. It's a simple acronym that guides you through each crucial phase of the routine. It stands for Soften, Multi-Cleanse, On-MAP Acids, Only Ready Release, Tamp Inflammation, and Hydrate plus SPF. Each step builds on the last, creating a comprehensive system that not only clears existing blackheads, but also prevents new ones from forming. Let's break it down, step by step. First, S. Soften. The goal here is to gently loosen the hardened, waxy plugs in your pores, making them easier to remove in the following steps. Take a clean, soft washcloth, soak it in warm, not hot, water, wring it out, and press it onto your blackhead-prone areas for 2 to 3 minutes. The gentle, consistent warmth helps to soften the solidified sebum. Using water that's too hot can strip your skin of its natural oils and even lead to broken capillaries. An easy alternative is to perform your cleansing routine right after a warm shower. It's vital to remember that we are softening the contents of the pore, not opening them. Pores are not doors. They don't have muscles to open and close. This step simply makes the plugs more pliable and cooperative. Next, M. Multi-Cleanse. This is a non-negotiable 2-step process that is the cornerstone of a clear complexion. First, on completely dry skin, massage a cleansing oil for a full 60 seconds. Really focus on your T-zone or wherever you have congestion. The scientific principle is simple. Like dissolves like. The oil in your cleanser will bind to and dissolve the hardened oil in your pores, as well as makeup and sunscreen. After a minute, wet your hands and continue massaging to emulsify the oil. It will turn milky. Then, rinse thoroughly. Second, follow up immediately with a gentle water-based gel cleanser for another 60 seconds. This removes any remaining oily residue and water-based impurities. A key indicator of a good cleanser is how your skin feels after. If it feels tight, dry, or squeaky, your cleanser is too harsh. It's stripping your skin's protective barrier, which can ironically lead to more oil production and more blackheads. Now for the first O, on-MAP acids. This is where we bring in the smart work of chemical exfoliation. I use a beta-hydroxy acid, or BHA, specifically salicylic acid, in a low concentration of 1 to 2%. I apply a few drops to my fingertips and gently press, never rub it onto my personal blackhead map, my nose, the sides of my nose, and my chin. BHAs are oil-soluble, which is their superpower. It means they can penetrate through the oil in your pores and exfoliate the pore lining from the inside out, dissolving the mixture of sebum and dead skin cells that forms the clog. Start by using it 2 to 3 times a week and see how your skin responds before increasing frequency. Once a week, you can supplement this with a 45-second enzyme treatment or a short contact clay mask on the T-zone to help absorb excess oil. But please, skip the gritty physical scrubs. They are too abrasive for the delicate skin on your face and can create micro tears, leading to irritation and inflammation. The second O is for only ready release. This step is entirely optional and must be approached with extreme care and hygiene. I use a traffic light system to decide what, if anything, to touch. Green light. A fully surfaced blackhead where the dark, oxidized plug is clearly visible at the top of the pore. These are the only candidates for manual extraction. Yellow light. A closed bump under the skin, also known as a closed comedone or whitehead. The plug is not exposed to air. Do not touch. Forcing this can rupture the follicle wall underneath the skin, spreading bacteria and causing a much larger inflamed lesion. Red light. Anything red, painful, swollen, or cystic. This indicates inflammation or infection. Leave this for your skin to handle or for a dermatologist to treat. Messing with these is a fast track to scarring. For a green light blackhead, and only after cleansing, I sanitize a stainless steel comedone loop with rubbing alcohol. I place the loop just past the edge of the pore and apply very gentle, even pressure as I roll it back over the pore. The plug should glide out easily. For a ready whitehead, I use 2 Q-tips at a 45-degree angle on either side of the blemish to press gently in and up. My absolute, unbreakable rule is the rule of 2s. I give it 2 gentle tries. If the plug doesn't release with minimal pressure, it's not ready. I stop immediately. Forcing it will only lead to bruising, broken capillaries, or post-inflammatory hyperpigmentation. It's better to leave it and let your BHA work on it for a few more days. Which brings us to T, tamp inflammation. After any extraction, or even just after using acids, post-care is critical to calm the skin and prevent further issues. If I've performed an extraction, I first do a gentle sweep over the area with sterile saline to clean it, then pat it dry with a clean tissue. I then apply a micro dab of a salicylic acid spot treatment directly onto the treated pore to keep it clear. If there was any fluid or if it was a whitehead, I'll cover it with a hydrocolloid patch overnight to absorb impurities and protect it. Finally, to reduce any immediate redness and soothe the skin, I'll use a wrapped ice roller or a cold compress on the area for 30 to 45 seconds. This vasoconstriction helps calm inflammation quickly. And the final crucial step, H, hydrate plus SPF. Healthy, balanced, and hydrated skin is far less prone to blackheads. After your active ingredients have had a moment to absorb, you must replenish moisture. Dehydrated skin can overcompensate by producing more oil, leading to more clogs. I use a lightweight hydrating serum with ingredients like hyaluronic acid or glycerin, followed by a non-comedogenic moisturizer to lock everything in and support my skin barrier. And in the morning, the most important step of all is applying a broad-spectrum sunscreen with at least SPF 30. Chemical exfoliants like BHA make your skin more sensitive to the sun, and sun damage undermines all your hard work. Protecting your skin from UV rays is absolutely non-negotiable for both skin health and preventing marks from darkening. A few final thoughts. Be patient. With consistency, you should start to see a noticeable improvement in 2 to 4 weeks, which is about 1 full skin turnover cycle. The biggest mistakes people make are over-exfoliating, using scalding water, and squeezing with their fingernails. Remember, gentleness is key. When you first start using acids, you might experience a brief purging period where things seem to get a little worse before they get better. This is normal, as the BHA is bringing underlying clogs to the surface. It should only last a few weeks. However, if you have persistent irritation, or if your acne is predominantly deep, painful, and inflamed, this routine may not be enough. In that case, the best and safest course of action is always to consult a board-certified dermatologist. They can provide a professional diagnosis and a tailored treatment plan.